Hello everyone and welcome to my scoliosis journey video. I wanted to put together this video really quickly because next Wednesday, December 18th, I'll be going in for my 4th spine surgery and I want to document that journey as well. My fusion started in 8th grade after bracing didn't work to correct my curve. I have kyphosis with my scoliosis, so the doctors thought the best option would be fusion surgery. This video will focus on my journey from the last surgery I had last September, but the titanium rods broke due to a failed fusion, so all the hardware was replaced except some screws were reused. When you go on the day of surgery, they might have you take blood, and then you get undressed, wipe yourself down with sterile wipes, and then you get dressed in a gown. Nurses will come over to put an IV in your hand, and they might give you anxiety meds to calm you down if you're nervous. They did that my first and second time, but I didn't have any for my third time. My doc wanted to sign his work, so you see that there. After this surgery, I had the worst pain that I was ever in, and it felt like I wasn't given any pain meds, even though they told me they gave me a lot. I wasn't drowsy, so maybe they didn't give me the correct dosage. I had a morphine pump, and then was sent home with Tylenol 3s and something for nerve pain, but eventually I was switched from the nerve pain meds to Gabapentin, and that helped tremendously. So if you don't think your pain is nerve pain, you should probably ask to be put on Gabapentin. That really worked for me. They gave me antibiotics in the hospital, which gave me oral thrush, and I woke up with tendinitis in my ankle from the position I was laying in on the table, and I broke out in blisters on my mouth, which is my body's normal reaction to stress, but that just made the recovery process so much worse. Not everyone has this after their surgery, but I was given a spirometer to strengthen my lungs. So basically you just breathe in and the thing will go up, and you want to see how far you can get it. And then the lady came in to give me physical therapy the first day after surgery, I think, so like the next morning. And she's getting me up out of bed here. And then she makes me walk and sit in a chair. This is really hard, but you guys can do it and you'll get used to it and it'll get easier each time.
I heard before I came in. Do you want to push it again before you start to move? Okay.
Here you see a 19-year-old with a teddy bear, but my boyfriend got it for me, and I've had it since my second surgery, so of course I have to keep the tradition going. Also, you just saw me press my pain pump before I got up.
We're at the exciting part. Alright, so we're going to roll these. How tall are you? 5'2"? Alright, you might have to adjust the bed height once you're up. Okay, so remember, shoulders and hips have to move together. So you're going to roll a little extra. Yep, this way. I'm going to cover your tail so that the video doesn't catch that. Alright, I'll help you with your legs if you can push with your arms. Okay, so push right through the bed. Alright, ready? 1, 2, 3. That was beautiful. So well done. You want to get a good shot of your hair in this moment? What bedhead truly looks like.
I'm cringing right here because I look so chunky. I've lost like 20 pounds since my last surgery, so oh my gosh.
Alright, what are you feeling right now, right here? Good. Feel good? Any numbness, tingling, wooziness? Take that with you. Do that. To the back of your gown and on this side of you. What is it? So no numbness, no tingling, dizziness, nausea. You okay? Alright. I'm going to lower the bed to whatever much lower we can get it. I don't know that we can get it much lower. Okay. So we're going to try to scoop and get your feet close to the floor, okay? Good. Oh, it's just like another Thursday here. Alright, just sit here for a second. You gotta make sure all your lines are uncrossed when you start to move a little bit. You know, it doesn't make for great TV. I apologize. Alright, I'm going to stay on this side of you just because of all your lines and stuff that are on here, okay? We're going to just try to stand. So we'll see if Mom wants to switch over here and get a good shot of you.
You're wonderful. Thank you for being so cooperative with us.
Sure. This is your journey. We're just here to make you work. Alright? Okay. Go ahead and stand up. Just stand here for about 60 seconds. Just take some nice deep breaths.
Wow. You're amazing.
You're just making it look easy. You could maybe be the poster girl for this, and maybe Dr. Gabe was supposed to do that at this point in time.
Spinal fusion.
I know, do it, everybody. It's so easy.
This
Get it
is
fixed.
less than 24 hours after surgery.
Less than. All right. How are you feeling?
Good.
How's the IV feeling even in your hand? I know
Oh, it's fine.
It feels a little pokey.
It's good right now.
All right, you ready to make the trek?
I'm ready.
Let's go. Thank you for being so calm and accommodating
Look
with
at you,
that.
my rock star.
This is not what it usually looks like, Chloe.
Rocking the
Let
third
Chloe
spinal
know that.
fusion.
No, it's not.
This
My
is
first
not.
one was
This is not how it went, right? This is not how it went
No.
down.
It wasn't, no.
Yeah, you can. It's too bad you don't have those video clips of the first
know.
time.
I know.
You're like, oh,
It was just way too much.
it's just too much. It's just too much. Do you want to move it a little behind you?
Yeah.
All right, and then do you want the ottoman under your feet? Some people like to feel their feet on the ground. Some people like their feet to be propped. So it's really up to you. And that slightly reclined, you can also move it up, right, more.
You can move it this.
Yeah, I had it reclined,
Squeeze
just on the
these.
sides,
And
yeah.
then just move.
I guess she
How's that?
she works.
Okay. What do you think about your feet? You can prop something under it, or no? You just want to let them swing for a little bit?
What's the problem?
Okay. Wow, that made my job look really easy.
Sorry about the
You make it look really good. You make it really, really good. I'm gonna highly suggest Dr. Gibbs to talk to you about starring in the video. Alright, I'm gonna just move this behind you. This is for you. Okay. Any change in your back pain? Any change in your legs? Once we got you back up and over here.
So you see here, this is a picture of me sitting for the first time after surgery. And as you can tell in my face, I don't look as swollen as I did when I first came out of surgery. So if you go back in the video, you can see that I had like Vaseline over my eyes and my face was super puffy. It's because you're laying face down for so many hours. I think this one was like 6 to 8 hours, and then my first one was 11. So your face is gonna be puffy, but it's gonna go down. And this is me getting up and walking for the first time. She took me around. It felt pretty good. Like, I didn't feel dizzy or anything. Some people might feel dizzy, but you just need to take it slow and realize that you're adjusting to a new back, basically. Hopefully in less pain than you were before you went into surgery.
All the
That's a
gardens are
nice
past
room
there.
over
Yeah.
there.
Look at that one.
Yeah. You can go ahead. You come on, kid.
Welcome to my crib.
Wow.
Welcome to my extended crib.
Darn, that couch right there, that love seat, that looks comfy enough
That
to
was
sleep
something
on.
maybe for mom. Probably not for you right now, but yeah. The gardens are over there, so it's just the perfect time of year. You can't really see very much from here, but there's the mansion. You see that over there to the left? That's the Moore's mansion.
From our room, we can see the
You can probably see
tree
the watchtower.
Yeah,
Yeah, the
yeah.
watchtower. Yep. Well, when you're feeling better and you come back for your post-op visit, you should take a walk through the gardens because they're beautiful. Walk out, like near, where the playground entrance is. So.
I forgot to mention before, but you'll have a catheter in, so you can see my like pee bag right here, and you're gonna have that in for a good amount of time until you can get up and go to the bathroom by yourself, or until you're comfortable doing that. And I would make sure that you have a constipation medication on hand. Sometimes they'll give you stool softeners, or you'll have to have an enema, and I had to have that after my first surgery, which was the worst. So really try to eat your fiber or find something you like. I used a tea, that helps, but I ended up having to go to the hospital and get a stomach x-ray and found out that my colon was backed up. So you just have to be very careful or you're going to be in a lot of pain. Here is more physical therapy. I have steps in my house, so they had to make sure that I could go up and down a flight of steps before being able to be discharged from the hospital. So here I'm doing that. I felt great doing this. This was my third time, so I was pretty used to how my back felt after surgery. The first time it was very difficult, but you get used to it, and they make sure that you feel stable doing everything before you go home.
Wait a second, just make sure no dizziness. No. Alright, same here on the way down.
Look at you.
Lead to your audience.
My rock star.
There you go.
So these are the sterile strips I had, and underneath of that are dissolvable stitches. I actually had a slight allergic reaction to the stitches and had a hematoma. So I ended up having to go back to the hospital for this because I bled out the incision. And this is me here, back in the hospital, probably 4-5 days after. And then this is me like 2 weeks after surgery, feeling a lot better. This was at the post-op appointment. And I had something removed on my top right shoulder. This was me last June, 9 months after surgery, and as you can tell, you can barely see the scar. This is also a picture of me from last June. I lost weight by going to the gym and eating right, which also helped my back to feel better, but now I have a fractured vertebrae, so I'll be going in for surgery next Wednesday. I'm Sarah Johnson, I'm 20 years old, and I'm a junior in college. Please like and subscribe, and leave any questions in the comment section below. The next video I'll be doing will probably be a what's in my hospital bag. Thank you for watching, and if you're having surgery soon, I hope it goes very well.